Pain is extremely challenging to handle. One of the bigger challenges you have is the modulation of pain. When you're stressed out, you go to sleep and you're uncomfortable. You wake up at 3 in the morning, you're staring at the ceiling, and the lack of sleep increases anxiety. You're stressed out about waking up in the morning, going to work. By the time you get home, you're tired, you're exhausted, your pain is worse, and your perception of pain is worse. You're thinking about that stubbed toe all day long. So let's say when you stub your toe, you start rubbing it. And the reason you start feeling better is because your touch fibers are larger and faster than the C fibers that are tinier. And so you overwhelm the C fibers that cause pain. Now, after a couple of days of walking, you're hurting, you're limping, but 3 or 4 days later, the pain goes away completely. 5th, 6th day, you remember, I stubbed my toe and I was walking around uncomfortably, and now that pain is gone completely. And it's because your brain modulates the pain. The opposite side, pain actually gets worse if you're stressed out, if you're anxious, and that causes this vicious cycle where you're not able to rest, relax, be comfortable, and all of those things spiral out of control. There's a strong overlap of folks that have stress or anxiety, and you don't need to have a diagnosis in order to do that. All of us have some level of stress and anxiety. When you start having chronic pain, both of those combine and actually make each other worse. So stress makes your pain worse, pain makes your stress worse, and you're not getting any time to actually be comfortable and relax. It's interesting, when we did studies on kids, we found out that one of the best things that helped were distraction. When a child cries, you distract them, and that actually downregulates the thalamic level in the brain. So what you want to do is try to be a little bit more interested, excited about different hobbies. So you are distracted. That helps your anxiety, and that also helps your pain. There are a lot of different ways to actually control your pain, and your mind is extremely important in that. There are therapies that will help guide you to reduce that, reduce anxiety, reduce stress, breathing exercises, and that helps control the pain a little bit better. If you're able to do things outside, get out into the beautiful sun, absorb some vitamin D, that itself will take you away from stress, anxiety, and help your pain. Here at ReclaimAbility Pain Services, we try to approach pain from a multidisciplinary approach. So exercises, physical therapy, interventions, injections, and we go through everything. Head and neck injections, TMJ, upper back, lower back, leg, feet. Our goal is to help you manage the pain better, feel less anxious, and recover a lot faster. Be a better you, for lack of a better way to say it.